You're listening to the Whole Healing Radio Show with me, Dr. Amy Dayries. I'm a dentist in Roswell, and this is going to be a really special night. A personal close friend of our family, Dr. Russ Thomas, is here with us, and we are here to talk about self-care for care providers, all kinds of aspects of taking care of yourself, why you need to take care of yourself while you're taking care of other people, the many aspects. And Dr. Thomas here, he practices internal and urgent care medicine, internal medicine and family medicine up in Cumming, Georgia, about 10 miles from Roswell. And he is a graduate of the Emory University School of Medicine in Atlanta, Georgia. He lives in Alpharetta with his wife, Catherine, and 2 beautiful girls and a new puppy, which surprises me. And you've been practicing a lot of years, all kinds of family medicine.
Yes. Since 2003 when I finished residency, 2003. So pretty good bit, 15 years.
Pretty good bit.
Yeah.
And I know you pretty well. I know you grew up in Mississippi, and you've done all kinds of jobs along the way before you went into medicine.
Yes.
Even picking cotton, which is an interesting
worked in the cotton
story.
field a little bit.
That's some hard work.
That was a valuable life lesson.
Absolutely, because we learn in healthcare, we see all kinds of everybody, and you need to understand everybody's coming from different places in their life, and they're going different places in their life.
Right.
I think having those cross-sectional,
be able to communicate.
Yes, and understand we're not all the same at all. But I think on a universal level, a lot of us kind of want a lot of the same things.
Right. Yeah. It's important to be able to communicate with people with their language, the language that they're comfortable with, and that they're used to. So not everybody responds well to the 50-cent medical words, the long 4 and 5 syllable words that. So it's important to be able to put things in the way someone else can understand them and integrate them into their life.
Yes.
And not just talk at them.
So it's not so sciencey. It actually has a meaningful.
Right.
We had the same kind of issue when we were in dental school, Russ, where we had at least seriously 2 books and several quarters of learning all these very fancy words to kind of mean like the front and the back of a tooth, or what a cavity. There's all kinds of words for cavities, and I mean it's very confusing to people. And and then you feel like you have to practice these words when you right when you get out of school, and you're told to use these words in school. It sounds very fancy, and you sound so educated. Right.
I find that. In the beginning, when I first started, I would use that language as I gained some perspective on myself through years of practice in life. I realized I was using that language to protect myself from experiencing some sort of an emotional connection with others, to keep from having to feel too connected and too invested and too attached, and I would use that language in a way to separate myself, and in the end it just becomes a little arrogant.
Well, that's not the intention, but I that's part of why we wanted to have this show. We were talking at a graduation a few months ago about this, and I think we realize when we're in healthcare that you realize you have to maintain sometimes the separation with people, and yet you want to be very balanced. You want to be caring. That was the reason you got into these professions. But there's a drain that happens when you're giving to people all the time, and you may also have family obligations or relationships that, of course, require your participation and intimate support. But then it's the demand, the everyday demand, year in, year out on the job, and so you have to find ways to protect yourself.
There are appropriate ways to protect yourself, and then there's the white coat shield of that acts like your armor, that becomes like an impenetrable barrier for a lot of people.
Yeah.
And it puts people off, and makes people feel uncomfortable at a doctor's office. You know? And when you've lost that comfort where people don't feel comfortable talking to you, or they feel like you're going to talk down to them, then they're not going to be very honest about what's really happening.
Right.
And so you'll have to pull it out of them or read between the words of what they're saying.
And then you could really get it wrong.
Absolutely, yeah.
And especially, the way that just the dynamics of running a business and an office and medicine has to be a business because people have mortgages and they need to eat and things. But it's, you may only have a set amount of time, and there may be somebody who got put in on the schedule, and they deserve to get every question answered. They deserve 100% of what you have to give, but you've got to get in that room and cut down into what it is that they came in for, and then deliver, hopefully, a really nice solution. And sometimes that's really hard to package into a few minutes of time that you are allotted. That's a tricky...
And all the while conserving your own energy and mental power to go on to the next person.
That's right.
Who needs all that as well.
And I think there's a perception out there that, there's a steady income there. They really have nothing to complain about. This is not a complaint. This is an explanation of how sometimes I think doctors can become seemingly detached from the situation. This is how they can get burned out. And in some cases, maybe that can lead towards addictions or unhealthy practices outside of the office. And you really want your doctor to be as good as they can be. Just like you want... We were having a computer issue at our office last week. I want a very happy IT guy.
Yes.
Because then he's going to fix my computer when there's an issue.
You got to make good friends with them.
Yes, you do. So that's another reason we wanted to have this program, is just to talk about the many aspects of self-care. What is self-care? When is self-care maybe selfish? That's a good question. And talk about maybe some of the things that you've come across through your learning and journey into self-care. And I had some things to add with that. And, anytime you're seeking medical advice, when you're listening to a show like this, this is not personal medical advice for you. We always recommend you seek out personal advice. And I can tell you, Dr. Russ Thomas here is an excellent physician. He was in the top of his class at Emory. You were on scholarship as well. And Emory is it's one of the best medical schools anywhere. And the Emory doctors, I'm an Emory grad, but they didn't have a dental school, so I can't claim this. But they really think on so many additional levels than I've run into a lot of other places with their training. I'm very serious. And if you want to see Dr. Thomas as a patient, he is taking new patients, and his office number is 770-205-2804. And it's Northside Family Medicine and Urgent Care up in the Cumming location. And they are Emory. You are Emory associated, correct?
Northside.
Northside, excuse me.
Yeah.
That's why it's Northside Family, not just because it's on the north side of town.
Right, not just because it's on the north
things
side
like
of
that
town.
a lot. Got it. Okay.
It's just conveniently on the north side of town.
Okay. And so we said before, we have a little chat before we do these shows, we were going to talk about how we met. And that really just sort of started probably this show tonight, but it was years ago.
It's a good family practice story.
Yeah, probably. So his wife, Catherine, has taught Irish fiddle to one of my daughters for years and years. I'd have to do the math. I'm going to say 7 years or so.
And more than
at
that,
least,
I think.
Probably.
Yeah.
And so we would come over, and I was kind of a sitter for some younger siblings while this lesson would be going on. And then Russ would come in from work, and he'd be just absolutely knackered, and he would need something to drink. And I would feel like I was separating a cat fight going on with some of the kids usually, and he would be oblivious, and I knew he would be exhausted, and I would be hanging out trying to take care of the kids while this lesson's going on in the adjacent room, and Russ would be there exhausted,
tired,
like in a state of vegetative state.
And we would start talking about medicine and dentistry and our experiences throughout the day, and it became quite therapeutic.
Yeah, it was.
And quite healthy.
It was. And you start realizing that there's a lot of similarities between medicine and dentistry, and just the sense that you're taking care of people on a very personal level. It's a very stressful job. And you don't, when you care about these patients, you can't just leave it at work. It does come home, and it affects your relationships. And the struggle was there for me, and I think for us too, but we dealt with it different ways to try to cope and be able to go back tomorrow.
Yeah, right. And we it became a good friendship where we could share what we were experiencing and make it become positive, and learn and learn. And we talked a lot about integrative medicine and healthcare as well. And we both got more and more interested in that, I think, over the 7-8 years.
I think so. We both have, we've both gone into a lot of extra continuing education to sort of feed that interest, but completely different programs. And it's, I think one of the misperceptions out there with a lot of newer doctors or healthcare providers of all kinds is that maybe it's just them that had a bad day and then they're struggling. But if you look at statistically, for instance, in my profession, the dental profession, there have been a lot of suicides. There have been a lot of addiction problems. There is a dental task force of dentists to take care of the dentists that have become hooked on opioids, for example.
Dentists do have the highest suicide rates of all healthcare providers. I have no idea why. Not to belittle, I just don't understand.
We work in millimeters, Russ.
Maybe
everything is in millimeters, and the success is in millimeters.
That is, is stressful.
That is not normal.
No, it's not. And in medicine, the highest suicide rate is radiologists.
Really?
Yeah, which is also, I think about that. You're sitting around in a dark room looking at skeletons and pictures of bones and cancer all day. I think that would get to you, And I see, and I do understand more after what you just said. Like measuring life in millimeters would get a little neurotic.
It does, because then you don't understand why other people don't think like that.
Right. Makes it harder to communicate with others.
Absolutely.
And share what you're experiencing and share your frustration over that 4-millimeter gap.
That would be a complete failure.
That would be absolutely.
A quarter of a millimeter is a failure. It has to be, seriously, it has to be dead on. So that's, 4 millimeters is absolutely, you need to be out of business.
I had since we're on the subject of integrating care, I had a great case today that I thought that we could talk about. Was a person who had she had been suffering terribly from allergies and all chronic sinus infections and chronic sinus congestion and headaches and fatigue and brain cloudiness. So she was getting allergy shots and on a variety of allergy medications and medicines to help with depression and medicines to help with focus. And all the while, her teeth were rotting out of her head, basically. And she did not have dental insurance.
I see.
Which she had healthcare insurance, but no dental insurance. And then when we finally broach this topic, got around to that, which is a sensitive topic to talk about.
It is. It's very personal, and you're talking about aesthetics a lot of
when
times,
you're
too.
Getting into, your teeth aren't very well cared for, and they're decayed, and maybe you should go see a dentist and see how this goes. And so we ended up getting her in to an oral surgeon who extracted every one of them.
Oh, wow.
And now, amazingly enough, her allergy symptoms are almost gone, and her face is not swollen anymore. Her headaches have gone away. She can breathe at night. Pretty incredible story.
That is incredible.
We're getting her off the medications, because all the while we were treating all these symptoms of the problem, which was her teeth, which was a difficult topic to broach, because it is aesthetic.
And she came to you for the other symptoms, not for her teeth.
Right. We came, and it became a bit of a, we were looking at all these symptoms, and the problem was her teeth and not the medical.
That's sad. I'm glad she found
I'm glad we figured it out, but it just took a little while.
Today you said you were sort of following up with a patient.
We were just following up. Yeah, this took some time to get to the bottom of, but I think we sorted it out.
So she had started out coming to you for a host of a lot of other symptoms and ended up, unfortunately, needing to get some teeth out, all of her teeth out.
Yes.
But now she's resolved.
Yes, she's
a lot of things.
Fantastic. Yeah, and a lot of the other getting off medicines. Fantastic.
There's a lot of connections. The teeth are really kind of between the brain and the heart and everything else. And what I've found out in a few weeks, I'm going to have an acupuncturist on, Dr. Gretchen Setz, and we're going to talk about the connections with meridians and teeth that they teach in acupuncture. And I have found by sending sometimes people to, for instance, there's a woman I was following up with today. She was having eye trouble and had 2 root canals and a tooth. Came to me because she was still having dental pain. And she was also on a PPI, a proton pump inhibitor for acid reflux.
Like omeprazole or Prilosec or Nexium. You see them at your pharmacy.
And they say to take those usually a couple months. But, of course, she had been on it for like 5 or 6 years.
It's easy to get perpetuated. Yeah.
And she went and saw an acupuncturist twice. And the eye trouble she was having, 90% of it, she says, went away. The dental problem went away. We were looking at having to maybe extract the tooth and get an implant. And she changed her diet. I had her read the acid reflux diet by Jonathan Aviv. He's an MD. And she did the 28-day diet. And she said she's like just about 100% better.
That's fantastic.
So there's so many connections where we all ought to be working together, dental people and all kinds of medical providers, so much more often than we're not like just over here. And then you guys aren't taught so much about teeth.
Not really. You more or less learn it. I mean, you get the basic about 30 minutes of it in a lecture in your first year of medical school, maybe an hour, maybe.
Well, in dental
to count them, and then I couldn't tell you how to count them now.
In dental and medical schools, a lot of the programs at a lot of the schools are combined.
Right.
Where for the first 2 years, the dental and medical students are really thrown together a lot, and then they like separate us, and it's like we're different species after that, and we might be, but. There's different species within dental specialties as well, but
I believe it. Same thing with medicine.
I'm sure. So radiologists, they really struggle with self-care. Sounds like.
Well, I couldn't say specifically. I just could say that is the highest suicide rate. So, but in terms of learning how to give yourself care so you can give care to others, I think is. Something that took me a long time to figure out. I went into this to take care of other people, and particularly take care of sick people, because I find it interesting and trying to explain to people. Part of what I find the most interesting is trying to discuss with sick people and help them understand what it is that's making them sick. And so that's giving care to them in that way.
And you're getting to the why, not just treating symptoms, because like the lady on the PPI.
That's the frustrating thing is, when you're missing if you're treating the symptoms and missing the core problem. We were talking earlier too about the idea of being a caretaker versus a caregiver, and it seems like semantics, but care. I think there is a difference, and I've heard many people talk about being a caretaker, and I've heard other people talking about it in reference to being a caregiver, and over time I've found that to be kind of a fascinating difference, and when people speak about it in terms of being a caretaker, I think that implies that has a more of a negative connotation to me.
Okay.
In terms of it implies that you're taking care from someone else, for some secondary gain.
Very interesting.
For some,
like a martyrdom.
Right, exactly. Yes, a self-imposed martyrdom in some ways, which is very unhealthy.
And there's
way
usually
of
an
looking at it.
attitude, a passive-aggressive sort of
Absolutely.
aspect to that.
Yeah, and you're gaining a secondary gain, is what we would call that, from caring for this other individual, whatever that might be. But if you think about it from that way, that's, I think, an unhealthier way of looking at it. If you think about it from being a caregiver, that you're putting that other person sort of ahead, the other person's needs and wants ahead of your own needs and wants, and but there's a healthy way of doing that, and there's an unhealthy way of doing that.
Yes.
And so over time, I think I've figured out a good practice for myself to prepare myself to give good care to others. So I think that being able to give good care to others and put another person's cares and needs ahead of your own is it's only possible if you've taken care of your own needs and cares before you get into that situation.
Yes.
So you have to prepare to take care or to prepare to give care to others.
Yes. Sort of like when you're on the airplane and they say put your own oxygen mask on before you put your neighbor's or your child's.
Exactly. Yeah, that's a great example of it, because if you're brain dead, you can't really help your child, so your child's going to be brain dead too. Because you've gotten no oxygen.
Right.
But so we talked about, wanted to talk about some of the different aspects of self-care to enable you to be a better care provider or caregiver for, in whatever way, even if you're taking care of your infirmed mother at home, or giving care to your children, especially if they're sick and have special needs and require a great deal of care, and you're especially putting them in front of yourself. There's some simple things that I've learned from people that I've worked with, and teachers and healers that I've studied with, and one of the biggest that I practice is we call it IPPG.
IPPG.
IPPG, which is I is for intention. So you sort of clear your mind and set your intention for your day. This would be it's best thing to do first thing in the morning.
Yes.
Where you you set your intention where I intend to have a great day. I'm going to have a good day. I'm going to be a good listener. I'm going to eat healthy. I'm going to take a break when I need to take a break to clear my brain. I'm going to practice my piano or my guitar or whatever. I'm going to make this time. I'm going to do this. I'm going to eat healthy today. And then you sort of purify. The first P would be purifying. So you want to purify your intention, and that's a loaded sort of statement. Like, what does that even mean? But I think it means that you want the things that you're going to do today to raise yourself and the people that you interact with to their highest possible good, to your own highest possible good and their highest possible good. And
that is very beautiful. And
that can be, their highest possible good may be a completely different value system from your highest possible good. But
as you continue to work, you continue to more and more align yourself with those who have the same system as you.
Right. And I think that too, though, I think you set your intention not to judge others, because let them make their own choices. But and then the second P, IPP, would be protection, where you imagine, sort of envision yourself, or at least the way I protect myself would be to envision myself surrounded in a beautiful white and gold light, and I imagine myself filled with sort of the light of goodness, and from God, or whatever your your deity is, or just the goodness of the universe, however you want to look at it. And then the final would be grounding. I try to envision yourself like being supported by the earth or enveloped by the earth, and I try to envision myself as growing like a tree out of the earth and sprouting from it, and it just keeps you present.
Yes.
In the situation.
And I think a perspective that you're in a way sort of a tool for a delivering a purpose. And
exactly.
you're connected and you're very present with the person who stands before you, who you are treating, but you also see that you're a different entity from them.
Completely. Yes, absolutely. Yeah, you're a separate entity.
You're a separate entity. I did a healing touch course, and the process sounds similar to that. And you envision having your feet firmly planted in the ground, and then sort of a column of light kind of coming down from, or coming out and into you through like your chakras, all the way down to where that your feet are grounded in the floor, and you stand with your hand, or your feet, excuse me, on the ground. I know in some practices too, the healer will actually maybe use like essential oils or wash their hands, not just to be clean, but to, as part of that ritual of getting ready.
To protect, and some of it is to protect yourself from taking on that other person's energy and sickness, and to keep them from taking on your energy and sickness. So it's about protecting yourself from attachment and aversion.
But being present.
Yes, while at the same time being present with them to help them to help you to both attain to your highest possible good that can come out of this situation, out of this interaction. Because there's a lot, I mean, it's not just a one-sided affair. When you are taking care of somebody, you learn a great deal from each person that you meet, and you can take on their negative energy, or they could come out of there taking on your negative energy.
Right.
And
so just, how I think everyone's been in this situation. Somebody looks at you wrong, and maybe you've got somebody next to you in the car that has road rage. That might negatively affect you. We take on those types of subtleties with patients all the time. So you see a lot of people that come in, I think a lot of times too, and we didn't say we were going to talk about this, but they come in crisis mode.
Oh, yeah.
I remember
major crisis.
Major crisis.
Yeah, sometimes the worst day of their life.
A lot of times probably, and they have to have a call. I mean, they have to be seen right now. They probably, and they're grateful usually that you're going to see them. You have to go through intention, purification, protection, and grounding to see any of these people.
Well, I think sometimes you don't have time to do that between every person you see, but you set that intention at the beginning of the day and try to renew it somewhat at lunch, and then at the end of the day, I go through a bit of a purification process at the end of the day as well, to try to be able to walk away from it, and let it be, because taking on other people's problems is not really the role or of caregiving, and it only really creates an unhealthy balance in your own life and for them and your relationship with the person.
That might have been in a way what you were kind of explaining when you were talking about caregiving versus caretaking.
Right, exactly.
You don't need to take away their experience. That's their experience.
Right. It's very important that they're having that experience for a reason. Everything, I think, happens for a reason. It may be difficult to find that reason, but I can't take that away and shouldn't take that away. And I think my role is to support people through their crises and try to come up with a logical, rational, responsible solution, to help in with them at the same time. The two of the patient and myself, we have to work together to come up with that solution. That's
sort of an integrative approach too, where you're really empowering the patient to make a choice about how they want to be treated and the method of treatment. I think also when you are, it's almost it's a group effort there. I think there's a better awareness for the patient that they walk away, that they realize there's a physical and emotional and a spiritual side of health. So they come to you, let's say with a crisis, like an emotional crisis, and they think they need a pill for that, or they hope that or they're assuming they're gonna walk out with something tangible that you gave them to fix the problem.
I think that, pills play a role, but the advice can be quite tangible as well. And I think we would be very remiss not to speak about the physical in all of this. And one thing that we miss in physical health, I think, is movement. We talk a lot about running or aerobic exercise, which can be somewhat of a repetitive motion, and also we talk about strength training a lot, but we ignore a great deal of flexibility and just movement, like dance or good basketball or something. I mean, that's
fun.
A great movement.
It can be
fun movement. Yes. That movement releases a lot of the stored negative energies, I guess, that we hold on to throughout our day. So things like yoga and Pilates and Tai Chi, can be, and dance. These are amazing avenues to release a great deal of negativity and get into really good shape at the same time.
That's right.
And release, and they're quite curative, I think, for a lot of problems.
There's some studies that have been published in medical journals that show or are trying to demonstrate that yoga, for example, can be as effective as physical therapy for potentially like lower back pain.
I would say Pilates as well.
Yes.
Yeah, Pilates is one of my favorite things. It's my favorite exercise. It's become that over the last 3 years. It's made a huge difference in my life, and there are times when I'm in the middle of doing those exercises on the reformer that I can just feel the negative energy just release out of me, and I feel liberated in that movement. It's been quite an educational experience for me. And I'd have to say give a shout out to my Pilates teacher, Alpha Pilates, Rebecca. Thank you.
That's cool.
Yeah.
My Pilates is Wendy's, and my yoga instructor is Monica.
So
shout out to those ladies. Yeah. It really has made a huge impact in my life as well. So we've both found it sounds like relief from taking care of others through doing some movement and exercise, and I'm unapologetically gonna try to do those things on a regular basis because I'm so much better.
I think I have to. You have to. The movement to get to release that. It's such a release. I don't know how better to describe it than that. I feel like I breathe better, I move better, I sit better, I walk better, I interact with others better.
Yes.
And I don't feel as drained.
Yes. Because I think that's another little thing when you're in healthcare and you're treating patients all day and have for years and will continue to do so in all the days you can work. You make them that priority in that moment of conversation, but then you are constantly sort of under an ask, or you could easily be constantly under sort of an ask to ignore needing to use the bathroom or needing to eat on a regular basis. And so that's why kind of grounding those things in the morning, setting that intention for the day can be really helpful to take care of yourself, because there's no one who's saying, oh, it's your appointment time now.
Yeah. I've definitely gone through the day without failed to eat or do or both of those things.
Yeah, me too.
Yeah, and you're like, why do I feel so bad? And I'm like, oh, I didn't eat today at all. What did I do? But how did I get here?
So the other common some people exercise, but other people find they can get excellent self-care through, I think, religion or meditation. We talked about movement, but maybe also if they have time for hobbies or vacation.
Yes, definitely hobbies. I think it's good to exercise your brain and give your brain a complete break into something, and it can be anything, any kind of hobby, that has no, I think, long term, like where the long term purpose of it is anything more than just having fun. I mean, we just don't have enough fun. I mean,
we don't. When we're adults, we think we should. In America, we should.
I think everything has to have some sort of outcome, and we get powerfully attached to our outcomes, even with like our fiddle playing and our,
not at my house, but yes, but some people do really.
And getting attached to winning the piano competition.
Yeah,
and,
that doesn't matter.
No, I think it's about
the process.
It's the process.
It should have been about the process.
Yeah, it should have been.
Not about being able to put it on a resume or some sort of a list.
Yeah, exactly. Yeah. That was a hard thing for me to learn. Just have fun with something, and it doesn't have to be, you don't have to make, it doesn't have to be attached to some outcome somewhere. Whatever, pick it, straight A's or going to medical school or winning some competition.
I think, though, a lot of healthcare providers sort of got unintentionally groomed to be very high pleasers in the process of getting to where they got to be. You had to get probably straight A's. You had to not just get straight A's, but have a strong work ethic and probably do additional things to be able to get that yes into the healthcare program you got into, because it's a competitive process.
Right.
You had to score as good or better than a lot of the people around you.
Right.
And you had to say yes to a lot of self-sacrificing in most cases. You didn't get to go to that party. Right. You had to study instead. You had to spend money on a textbook instead of maybe that, I don't know, nicer outfit or something. So it's just, it kind of grooms somebody to maybe be a little bit lousier at self-care and taking care of relationships at home.
Right.
I think too.
Right.
Can suffer when you're a caregiver outwardly. So finding these outlets for yourself, I think, is so important.
Medical school has a very high divorce rate.
So did dental
school too, I'm sure.
Yeah, absolutely. And so these are also obviously things that can traverse a lot of different other professions, not just healthcare, but it's a huge issue for healthcare providers. And a lot of us feel very isolated and alone, and that's why I wanted to talk with you about this tonight.
Right. We had also talked about like meditation and the amazing benefits of meditation. I learned how to meditate from my teacher, Tom Lake. I have to shout out to him too. He taught me how to meditate, basically, and spending, even if you only have 3 or 4 minutes to spend in a breathing exercise can be incredibly restorative. And I find myself doing that more than anything else throughout the day. I'll just step into my bathroom, close the door, and just breathe.
That's what, no one will bother you.
No one will bother me in there.
I find
they definitely won't be breathing.
What happens? What do you see happen? These people come in. What would you say the main reasons when people come in a crisis mode? They're suicidal, Russ. What are the top reasons that you see for that?
Well, I think a lot of times, I think number one is loss of livelihood. Would be number one.
Yeah.
When people find themselves and their life completely turned upside down by losing their job, or particularly losing their income, they're facing bankruptcy. They're facing, they've wrapped everything of themselves up into that definition of and they've defined themselves by that. That seems to be, that's pretty big.
That's big.
Yeah. And then, loss of a relationship of some kind, any kind, when they've defined themselves very powerfully by that relationship. And so they, I think, and I was told this, but when the value of material things really supersedes and fully supersedes the value of love, then suicide becomes a very valid option for people. They begin to see it as a very valid option. They because they've completely lost sight of the value of love, and it's because the value of attachment has completely superseded it. And so that's when I think suicide becomes people begin to see it in they begin to think that that might be a good option, which is a terrible thing to think. But I mean, but and it's very sad to see yourself, to find yourself in that state. But it really is, and it's on the rise, and I think it has everything to do with powerful attachment to something other than like love.
Yeah.
You know, for yourself, or love for like genuine love for you know.
Or just even a love for life. It doesn't have to be in a relationship with someone else, but just finding things you love and stopping to appreciate those qualities in every day.
Right. I mean, it's the value of the human life is very precious and sacred, and it's heartbreaking to see when the value of the material has superseded the value of love and of human life.
Yeah. That's so poignant. I think that's really true. So they have these imbalances, and I know you talk with people about what they thought they were going to get, which was just a medication. A lot of people think that that's probably the answer, but I think there's a lot of work people can do and foster to feel better pretty quickly. Sometimes it's a long journey.
Well, medications can help. I don't want to.
No. I'm not belittling, or
right.
I'm not saying medications are not a.
It's not the only
help
answer. It's
at
not
all. Right.
I mean, but they can certainly help. In a lot of times, I think when a medication is called for, people find themselves in a foxhole mentality. They become very terrified, almost to even stick their head out of stick their head up and even look around, because they feel like the playing field is so uneven against them, you know. So a medication can help, I think, in some ways level that playing field by leveling out your brain chemistry to allow you an opportunity to maybe see have a little bit more perspective, as opposed to just having your foxhole perspective.
That's great.
And then, you know, so then you can employ some of these methods we've been talking about to maybe have a more healthier outlook on life, because it comes down, I think, to your perception of life and of your situation, and that the medicines can help you afford that a better perspective in some ways. Not that you need to be on it forever, or that they're the answer for everybody, but I do feel like I should at least say something about that.
Well, I know, I appreciate that very much.
And I don't think it's a defeat when you admit, oh, I need a medicine. I don't think that's a defeat. I think in some ways I think of that as like a victory, because you've decided that you're going to take a step, like a big step, in a direction that you want to get better, you know, and you're making an active choice to get better by choosing to do that. So it's not that different from these other things that we're talking about, because they're all choices that you have to make to get better.
Got it.
Yeah.
That's well put. I completely agree with that. And there's just so many applications of that I guess come to mind. And then I know I studied herbs for a while. I know there's some different herbs that can be helpful to people, and a lot of times those are interesting to me because they come with sort of different stories. For instance, passion flower is a very gentle, beautiful purple flower, and it blooms around the Easter time, hence the name passion share that with because of their professional role and the necessity for non-disclosure to others. And that was used as something that would comfort them. And it could be drunk as a tea, or you can eat it.
I think, that we also have to think about essential oils, which can be quite helpful in their applications as well. And I use sage a lot in its in its flowered form, where I will sometimes smudge myself with the burnt. At the end of the day, I will a lot of times smudge myself with sage to sort of clear my senses and clear my aura and my chakras through that. And I keep a little sage oil at my desk. Sometimes I will breathe that between visits with people, because it helps me to release my attachment to whatever was taking place in the previous room, so I can be fresh and go into the next room and be ready for the next situation. So I find that to be quite useful.
Sage has so many healing properties, and also traditionally, I also St. John's wort is another good one.
And we've been one of the big things on right now would be L-methylfolate. It's one of the active form of folic acid that we use in the brain. That can be a powerful supplement to help with mental illness, along with some B6 and some B12.
And the B12 there might be also methylated, right? Maybe.
Yeah, methylated B12
or methylcobalamin
is better absorbed, than the cyanocobalamin. So, yeah.
Those are very powerful. And there's I talk about it, or I seem to mention it a lot. There's a gene SNP that is over half the population has, called mother-father gene. That's just really an acronym, MTHFR.
Right.
And there's different manifestations of that, but those people...
About 14%, I think, is the deficiency level of that, some form of deficiency.
Depends, I think, on the population.
Right.
Native Americans, 90% of them have it.
Oh my goodness.
And I think Caucasians, it is closer to like 40%. They might be hetero. Okay. We're not just talking about like homozygous. It might be from one parent or two, but those people are going to do much better to take those types of.
I couldn't tell you
B6,
the exact
B12
numbers, but it seemed to me like the overall population may be like maybe 14, but obviously in certain groups it'd be higher, or lower. But I couldn't tell you exactly.
That's okay. It's something I talk about with a lot of our dental patients, because a lot of times they'll have more gum inflammation, actually, because they're lower in those vitamins. They don't absorb them well.
I did have a person with scurvy one time.
Oh, wow.
Where their teeth were falling out.
Yeah, that's vitamin C.
I know. It's like pirates. Yeah.
That's very interesting.
That was fascinating. Yeah, you don't expect to see that in the 20th century.
Well,
21st century. Well, it was the 20th century then.
What us dentists don't always do is, like, sometimes bleeding gums might not be that the person didn't brush well, but they might actually be vitamin C low.
Yeah.
And so.
Yeah, you don't think about that nowadays, but yeah, it could be.
It's very possible.
Nobody thought about vitamin D being low either.
That's true.
And it turns out, but it turns out to be profound, and to be having a profound impact on our hearts and our brains and our healing and our mood. And nobody thought about that at all when I was in medical school. It was almost an afterthought, but now it's everybody.
It is, and I think that where you were born, it transfers sort of a lifelong influence on your overall vitamin D levels. If you're born in a latitude closer to the equator, you seem to have better. You seem to hold on to it better, or you just have better protection from low levels. That's what I've learned.
Interesting.
I'm not a vitamin D expert. I'm just know parts, and I find them really intriguing, because again, it makes a big difference in people's overall feeling of well-being, and whether they're in for crisis. And we see a lot of people in dentistry, because we're touching people on their face and their personal bubble. There's a lot of sharing with those energy fields between people, and a lot of things that people just sort of let down when you're in their personal space about what's really going on with them. We can cut to that chase really quick. A lot of times
Interesting.
They don't mean to, but they'll just sort of let down and tell you a whole bunch of stuff you didn't need to know necessarily, but we welcome it because that helps us to get to the root of some of the reasons that they usually are starting to have health issues or dental issues.
Yeah. Yeah, I never thought about it in that way, but yeah, that is that interpersonal space is powerful. I'm always at a pretty good distance from people. I mean, get up in obviously when you're examining someone, but usually by then the conversation is, we've already had the conversation.
Right.
We may have more conversation, but usually while you're examining someone, it's not full of conversation.
That makes sense. You got to focus on.
Yeah, you're focusing on what you're feeling and seeing, and so you're focusing on different senses there, as opposed to your hearing so much. I guess you are hearing when you're listening with stethoscope. But.
Yeah. Well, Dr. Thomas, Russ Thomas, thank you so much. We're folding up our show tonight on self-healing, self-care for the self-aware aspects of self-care. But I hope a lot of people out there who have problems will realize these are very normal for people who are caregiving to people, and that there's a lot of solutions for yourself. It's not so crazy at all. And
don't be afraid to seek out help.
That's right.
Yes, please.
If you'd like to see Dr. Thomas,
there's always a solution.
Yeah, there are. You can look on our website or call Dr. Thomas 770-205-2804. And thank you so much for
having me.
Joining us tonight.
Yeah, thank you for having me.
Hi there. I'm Dr. Amy Dayries Ling, and I'd like to thank you for downloading a copy of my book, Solve Your Sleep for Better Health. Just click on the link. Together, we'll take a closer look at what's keeping you from getting to the core of your snore.